An alarming statistic shows more and more young adults are getting diagnosed with colon cancer. Well, this month, as we mark Colorectal Cancer Awareness, we wanted to speak with a local doctor on the causes, treatment, and prevention. Let's welcome Dr. Monty Singleton, physician and medical director at Singleton Health Center. Thanks for joining us.
Thank you
Yeah,
for
and
allowing me to be here.
you know, when we talk about colon cancer, well, it sounds like screening has gone younger and younger. You start your first screening at age 50. Back in 2018, they changed that age to 45, but we're seeing people in their 20s, 30s, and 40s being diagnosed with colon cancer. Why do you think that is?
We're still looking to see what is really going on and happening in terms of why this is happening. We have speculations, but I think a lot of it is a result of what we're eating and what we're doing, what we're drinking.
Yes. In fact, from what I understand is the use of alcohol, cigarettes certainly, but the ultra processed foods that we saw that uptick starting in the 90s really increasing. So do you think that that tide is going to change? You know, we do have a new director of health in the administration trying to kind of tamp down on some of the ultra processed foods that are on every aisle of every single supermarket.
I think that a lot of what we're seeing is a result in colorectal cancer is a result of the additives that are being put in our food. You know, I'm a physician as well as an ordained minister, and I truly believe that God created our bodies in such a way that we can metabolize the things that He created, but not metabolize the things that man has made. So we need to read labels and look out for artificial sweeteners, artificial flavorings, artificial colors, et cetera,
Sure.
in the foods that we eat.
And to get some control over the obesity epidemic.
Yes, exactly.
Are you seeing a lot of people who are obese that are being diagnosed with colon cancer?
Well, obesity is one of the things that are associated with colon cancer, all types of cancer.
And because we're seeing younger people being diagnosed, what are the signs that are leading to these diagnoses? Because, you know, it's easy to just say, oh, I'm not feeling so great, but you just sort of write it off. What are the signs of a potential problem?
Well, you know what? Interestingly, oftentimes there are no signs, but some of the subtle signs is that if you see any changes taking place in your gastrointestinal system, if you're all of a sudden not having the normal bowel movement patterns that you used to have, that may be a tip-off. Increased bloating and gas can be very subtle signs, but really alarming signs, or if you see blood in the stool. If you see
Yes,
blood in the stool at all,
right.
if there is blockages going on, those kinds of things are very alarming.
I see.
And some of the late signs might be fever at night, unexplained weight loss, decrease in appetite. All of these kinds of things are subtle signs to watch as well.
But when caught early, and thanks to various forms of screening, the cancer is quite curable.
That is correct. You know, and just to give a little statistics about colorectal cancer, there are 53,000 people who were diagnosed with colorectal cancer last year in the United States. That's over 1,000 new colorectal cancer diagnoses per week.
Oh,
And in
gosh.
South Carolina, we see or should expect to see about 2,000 new cases a year, and that equates to about 900 deaths. As a nation, we're looking at 50 million people who have not been screened, who should be screened. So
Yeah,
that's
that's
an
a
alarming.
frightening
And
statistic for sure. But also, what about some of the demographics? Because from my research, the highest rates are among Native Americans, Alaskans, and also the Black community.
and especially the African American community, it's very high, and we don't know why that is, but we just see that it's happening. So it's just um, a very important reason that we should really, really be encouraging our African American patients and our Native American patients
Hmm.
to really get screened
Indeed.
for colorectal cancer and start at age 45.
That's right, because also 1 out of 3 eligible adults actually have not completed their screening. So it's definitely incumbent upon us to do so. We only have a few seconds left, and there are various ways for screening, one of which is a blood test. Can you talk about that briefly?
I'd love to talk about blood tests because that's going to help us address these 50 million plus people that have not been screened. The test is blood based. It can be done in the doctor's office. That's why I've been so excited about using it, is because I don't have to schedule a colonoscopy, which is the gold standard.
Yes, Dr. Singleton, I really appreciate you sharing that information with us. And of course, we'll check in with you as we continue this conversation. But thank you again for all the information.
Oh, you're quite welcome, and you have a great day, and thank you for allowing me to share this information.
We're back after this.